here we are, Ashley. We are live and in person at the CCHF office. My name is Twila Brase. I am president and co-founder of Citizens Council for Health Freedom. And next to me is Ashley Smothers, who's our legislative and policy manager. And so today, which is the 18th anniversary of the implementation of the so-called Hipaa privacy rule, we decided to come to you and essentially do, she's going to ask questions, I'm going to give answers, and these are the sorts of questions that we get all the time. And whenever I speak about Hipaa, people are so surprised when they find out what it really is. And because we are the only organization in the nation that patient-centered, privacy-focused, we are trying to rescind the Hipaa privacy rule because it doesn't protect you, and we're trying to restore real patient consent requirements. So I'm so glad that you have tuned in today. Again, Twila Brase, Citizens Council for Health Freedom. And we are going to, Ashley and I are going to have a conversation here with her list of questions, and hopefully you will learn a lot about Hipaa that you do not know today.
Well, thank you, Tyler, for that introduction. I appreciate it. Like she said, I'm Ashley Smothers. I'm the Legislative and Policy Manager here at Citizens Council for Health Freedom. Prior to starting here, I really didn't know much about Hipaa at all, so I was really excited to be able to come up with these questions that I probably had many of them myself before I began. So it's a pleasure and it's exciting to be able to have this conversation here tonight. So with that, I'll go ahead and ask the first question. Twila, what does Hipaa stand for?
That is a very good first question. So that it is the Health Insurance Portability and Accountability Act of 1996, otherwise known as Hipaa.
And isn't Hipaa supposed to be a privacy rule?
So one thing to understand is that within that title that I gave you of the law is from 1996, there is a P in there. A lot of people think that that means privacy, that Hipaa is privacy because it's got a P in there, and because you've been told that it is privacy, but it's not. The P stands for portability, and it doesn't even stand for portability of data. It stands for portability of health insurance. Within the Hipaa law of 1996, there was a section called Administrative Simplification, and that section is what required a privacy rule to be written, either if Congress didn't pass it within 3 years, so by 1999, then the U.S. Department of Health and Human Services had to write a rule, and so of course Congress wanted to pass that off, and they didn't want to be blamed for taking away our privacy rights, and so the U.S. Department of Health and Human Services wrote that rule. It became effective 18 years ago today,
Yep.
So on April 14th, 2003, and that's the day that our privacy went away.
So then who would you say is able to see the data?
All sorts of people can see the data. In 2010, the U.S. Department of Health and Human Services actually created a list of the data, and that list is 2.2 million entities long, not people, entities. And in there are 1.5 million corporations or business associates, all of them who have nothing to do at all with giving you access to care, taking care of you in any way, shape, or form. There are places like, attorneys and data analysts and all sorts of other kind of businesses, mergers and acquisitions, all of these people who can have access to your data without your consent if those who hold your data, which are the clinics, the doctors, the hospitals, the health plans, the labs, the x-ray facilities, all those kind of entities, if they choose to share it, they can share it. So Hipaa is not a privacy rule. It is considered a permissive data sharing rule.
Yes, so then what would you say protected privacy then before Hipaa?
Oh, definitely, privacy was definitely protected before Hipaa. So privacy was protected by the contract, essentially the quiet or silent contract between the patient and the doctor, and by like with the attorney where it's client, attorney-client privilege, right? It's very much like physician-client privilege, and so they knew that they could get into trouble legally if they were to share the patient's data without the patient's consent. But as soon as the Hipaa rule passed or became implemented, because it's a rule, not a law, as soon as the rule became implemented 18 years ago, suddenly they could share all this data without your consent to all of these people.
So then if what you're saying is true, why did Congress enact HIPAA?
Congress enacted HIPAA because other people wanted access to the data. So one of the things that I say in my book, and I have a book here called Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, which has a chapter in there all about HIPAA to tell the truth about HIPAA, essentially. And one of the things is that the health plans really wanted to have access to the data, but there are so many other folks that wanted to have access to the data. There was a group called WEDI, the Work Group for Electronic Interchange. Work Group for Electronic Data Interchange, WEDI, and that was made up of corporations, data corporations, government agencies, business corporations, hospitals, all sorts of folks who wanted to share all this data without consent because data is very valuable and it's becoming increasingly valuable.
Okay. So would you say that's why you wrote Big Brother in the Exam Room?
Well, I wrote it to tell the truth about HIPAA, but I also really wrote it to tell about the electronic health records. So there's one chapter that talks about the truth about HIPAA, which is the section 4. But all of it talks about how we got the electronic health record, how the electronic health record is not meant for the patient or the doctor. It is meant for gathering data, for reporting data, and all of that is now allowable under the HIPAA, the so-called privacy rule, which we call the HIPAA no privacy rule. And so the electronic health record has become a surveillance system, and that's been allowed and permitted because of HIPAA, or by HIPAA.
Yeah, and I've read Big Brother in the Exam Room. It's a really great read if you haven't read it. So, Twila, what would you say is the most important thing that Americans should know about HIPAA?
Well, Americans should know that HIPAA doesn't have anything to do with your privacy. It has everything to do with eliminating your privacy rights. And so every time that somebody at a clinic says, you know, that this is all about protecting your privacy, you have to understand that it is not about protecting privacy. It was really about taking away your privacy rights.
So in the midst of COVID-19 and now the talk of vaccine certifications and vaccine passports, how does HIPAA affect the implementation and use of vaccine passports?
Okay, so that's a really good question, because the whole question of vaccine passports has come up, and people are saying, well, doesn't HIPAA prevent this? Doesn't HIPAA stop this? But you know, you now, if you're watching here or if you watch it later, you will be apprised of the fact that you now know that 2.2 million entities can have access to this information without consent. But the other thing that you should know is that the government is not under HIPAA. There are all sorts of companies, and lots of the vaccine passport companies, they would not be under HIPAA. So even when I say that, when people say, well, they're under HIPAA, well, HIPAA allows them to share all the data. HIPAA is really, another way to think about HIPAA is that it is a data security rule. In other words, it allows all of this data to be shared, but while you're sharing it, you're supposed to make sure that everybody else who can't have access to it doesn't get access to it. So that's why you can get in trouble through hackers or ransomware attacks or that sort of thing. So there's no problem at all with sharing your data in many and broad ways. But if you let it out and someone that's not in those 2.2 million entities gets access to it, somebody that shouldn't get access to it, then you can get into trouble. So, so regarding the vaccine passports, a lot of those companies probably aren't under HIPAA. They aren't affected by HIPAA at all.
Yep.
And if the government is any part of it, the government's not affected by HIPAA at all. So just understand that HIPAA and the vaccine passports have nothing to do with each other.
That's good information to have. What would you say is the most important thing that as a patient they should be able to understand about HIPAA?
So when you go into the exam room, so that I'm sure you've been into the exam room, I've been in there, and sometimes you get papers and sometimes you get an iPad.
Mm-hmm.
And what you have to understand is that if you choose to answer all of these questions, they are not going to be kept safe and secure in your electronic health record. They are going to be accessible to all sorts of other people, and so you have to think very carefully before you decide what you're going to answer. And in addition to that, when they want you to sign the so-called either HIPAA privacy form, or they want you to sign the acknowledgement statement that you have received the notice of privacy practices, then you have to realize that by law, you do not have to sign that. You're not required to sign it. They're required to make what they call a good faith effort to get you to sign it, but you don't have to sign it. And you might wonder, well, because HIPAA doesn't protect my information anyway, what does it matter whether I sign or whether I don't sign? Well, it's true. They can share the information whether you sign or whether you don't sign. But you have done several things by refusing to sign. One, you've acknowledged that this is all a big farce. It's a big ruse. You know that this doesn't matter whatsoever. But two, if you share something confidential and you find out later that they have shared it, then what they can do is they can take your paper with your signature and they can say, well, you see right here that you acknowledge that you looked at the notice of privacy practices, and when you looked at the notice, you realize it doesn't actually protect your privacy. It's just a list of all the ways that your data can be shared. And so having read it, then you should have realized you shouldn't have told us that information, and so it's your fault. And it says very clearly here that you read or understood the notice of privacy practices, so it's your fault that you ever told us.
Oh, that's quite a bit. So I know as a parent of small children, I go to the doctor quite a bit. Something that I see often with these documents is that I'm told that treatment can't happen unless I sign. Is it possible that as a patient to get treated without signing the HIPAA forms?
So this becomes a battle, and I have to say that the exam room, speaking as a nurse myself, the exam room should be a sanctuary. It should be a safe place, but it is no longer a safe place. And as an individual, or as a parent, you need to decide whether you're going to fight the battle or you're just going to sign the papers. Are you going to provide the information, or you're going to say no to the information? So I'll just say that I have refused to sign. I have called the manager. I have refused, once it got to a certain place in the iPad, I have refused to go any further. And they have told me, well, then we can't check you in. And I've said, bring me the manager. Let's talk with the manager about this. And I've said, I don't want to, I know where this data goes. I know I know all the people who can have access to this data. I don't want to do this. And so they figured out a way around the electronic data gathering system to get me registered. But they've been more insistent about the HIPAA form because they believe that they will get fined for a HIPAA violation if we do not sign the form.
Mm-hmm.
But there are clinics that actually understand that that's not true, and you can find them when you see at the bottom of the form or the consent form, it actually has a little space where it says patient has refused to sign the HIPAA form. And then they have to sign it, they have to date it, you have to do nothing. You don't sign anything, you don't date anything, you just don't do it. And I would say too about the iPads that they say, they give you this electronic signature pad and they say, you know, just sign here, it's a HIPAA form. Well, you don't actually know what you're signing.
Mm-hmm.
And so if you're going to even think about it, ask them for the paper copy. And refuse at every stretch of the imagination to sign the electronic form, because even if they give you that piece of paper,
Mm-hmm.
that still doesn't say for sure that you know that it's this paper that you're signing with your signature. So unless you can see the entire form on the electronic iPad, you should not sign it. You should only do it by paper, and then you should refuse if you can, and you can still get treated. You should refuse the HIPAA form.
Yeah.
I will say that I have walked out of one appointment because they absolutely refused, and I refused to sign.
Yeah, normally by that time I'm just ready to get my kids in and be done, but you know. So would you say that there's a better solution to protect privacy than HIPAA?
Well, clearly it is what we had before, and that is that patient consent was required before any data could be shared. That's the way it was for, you know, decades, maybe centuries. I'm not exactly sure. But I mean, you can go all the way back to the Hippocratic Oath where it says, I will not confide anything about my patient, which is, you know, that was, what was it, 400 BC or something. You know, I mean, it was a long time ago because they understood that what if the patient did not feel comfortable and thought you were going to say things. I mean, there are very sensitive things that have to be said in an exam room to get the care that you need. And doctors understood that you wouldn't actually tell the truth if you thought the data would go somewhere. And so this has always been a part of the confidential patient-doctor relationship in order for the doctor to hear absolutely everything that's wrong with you and for them to give you the right kind of care in a timely manner because you are confident that this is a safe sanctuary where your privacy and your confidentiality will be preserved.
I think that would be a great solution to have. So is there anything else that you think our audience should know about HIPAA, or any kind of key takeaways that they can take?
Well, one thing I'll just say is that today our organization, Citizens Council for Health Freedom, sent a letter to 4 members of the U.S. Senate and the U.S. House Majority Leadership, Minority and Majority Leadership, and we asked for 2 things. We asked for them to write a law and pass a law that would rescind HIPAA, would rescind the rule, and then we also asked for them, let me see, what was the second thing? Oh, we asked for them to actually write a law that would restore patient consent. But here's the other really important thing, because everybody who's listening is probably coming from states around the country.
Right.
And in Minnesota, we have the strongest privacy law in the nation. And, you know, correct me if I'm wrong, but do we have that actually in our legislative library for other states to access? I think we might, or I think we were going to be putting it in. So that's something that Ashley will look at tomorrow and put it on there if it's not in there. But we have a legislative library that other states can go to get our language that we have passed in this state. But the important thing to understand here is that whatever state you're in, ask your legislators to pass a state patient privacy law. Because one of the things about HIPAA is that it says if there's a real privacy law, a state privacy law, a stronger privacy law that the state has enacted, that is the law that must be followed. That is one of the ways to undermine HIPAA. If Congress never got rid of it, if HHS never got rid of it, the federal government just kept it in place, it would never have to be followed. If a state passed its own law, then that's the law that has to be followed. So that's a really important thing that that citizens can do in their own states to protect their own privacy. And this is becoming more and more critical. I will add one other thing about the value of data.
Okay.
So data has become essentially the gold mine of the 21st century, or some people call it the new gold. The new oil. And so just as one little factoid as it is, United Health Group has a division that's only data, that's all they do. United Health Group is the largest health plan in the world. And they have this division, and it's called Optum Insights. And when they reported their revenue for 2017, for just that, the data only, it was $8.1 billion. So this is the new gold. And there are contracts now between Mayo Clinic and Google Analytics, or Google. There are contracts between Google and Ascension, which is in 21 different states, a healthcare system in 21 different states. And so Google is getting access to all this data, and they are one of the business associates under HIPAA, so they can have it by law because of the rule. So I think that those are the things that people have to understand, is that HIPAA doesn't protect privacy, but a state law would bring your privacy back.
Yeah, I've always been a big proponent of more local control over things. It makes it a lot easier. So, well, Twila, that's the last question that I have. Is there anything else that you would like to say before we end our video?
Nope. I'll just say thank you so much for tuning in. I hope that you will hit the share button. I hope that you will follow us. And there are more videos to come, particularly on COVID-19 while we're in this time of COVID, but also on different issues. So stay in touch with us. Thanks again for watching, and I hope that you'll have a wonderful evening. Thanks so much.
Thank you, guys.
Okay, we're going to turn it off.